Step inside any pediatric hospital and, well, you immediately feel it, don't you? A unique kind of emotional intensity.
Mm-hmm.
It's a place brimming with hope, of course,
Mm-hmm.
but also confronting these profound challenges, not just for the young patients and their families.
Right. But crucially, for the dedicated professionals who are there every single day caring for them.
Exactly. And today, we're taking a deep dive into some really fascinating source material you've shared with us. It gives such a powerful look at this often unseen emotional landscape.
That's right. We've been digging into a stack of research papers and studies you provided, and what emerges is a really compelling picture, isn't it? Resilience, burnout, vulnerability,
All interwoven.
all interwoven within pediatric healthcare, yeah. Our mission here really is to pull out the most important insights from these sources, the nuggets, the bits that help us understand the emotional challenges faced by both the staff and the young people navigating chronic illness.
And how they all find ways to carry on.
And how they carry on, exactly.
Okay, so let's maybe dive into the world of the healthcare professionals first. The sources really highlight that working in pediatric care isn't just like medically demanding. It's incredibly emotionally challenging.
Oh, absolutely.
What are some of the key stressors the material points to?
Well, right at the top, the sources identified the significant emotional toll of witnessing patient deterioration and, sadly, death. It's just a constant presence for many in these roles.
Yeah, I can only begin to imagine the weight of carrying that.
It's immense. And coupled with that is this feeling of helplessness sometimes.
Uh,
There was one quote from the sources that really jumped out at me, someone saying, the kids just get sicker and sicker.
wow.
That sense of, being unable to stop the decline is a powerful stressor. The sources also point to the difficulty of delivering bad news
Hmm.
and the pressure of managing high expectations from families, from colleagues, often when, let's face it, resources feel pretty limited.
And the research doesn't just talk about this as a personal burden for the staff, does it? It connects it to wider impacts. This stress kind of rippers out.
It absolutely does. The sources are quite clear that this emotional stress isn't just contained within the individual. It's linked to increased sickness absence among staff, a higher turnover rate.
Which must cost a fortune.
Well, exactly. One paper cited an estimate of 2.4 billion for staff sickness absence costs to the NHS. Staggering. But, beyond the financial aspect, burnout is directly connected to reduced quality of patient care,
Right.
increases in adverse clinical events, poor decision-making, even things like reduced communication within teams. It's really a system-wide issue.
You mentioned specific roles having unique pressures, and the sources really seem to zero in on hospital place specialists. This is where it gets, particularly insightful into the nuances of the job, I thought.
Yes, definitely. The sources dedicate a whole core category to this, titled A Unique Role, and then they sort of break it down further. One major point is this idea of a misunderstood role.
Misunderstood how?
Well, despite being a registered profession, their work often lacks clarity. Sometimes it's even unknown to some of their own colleagues within the hospital.
Really?
Yeah. And this can impact their power or status within the team. What's interesting is that efforts to promote the role have actually improved recognition, which is obviously great.
Right.
But it's also led to this increase in referrals that the services then struggle to meet.
Okay. So success in getting recognized brings a whole new kind of pressure.
Yeah.
Like demand outstripping supply.
Precisely. Which leads directly into the next point they make. Feeling pulled in all directions.
How exhausting.
Yeah, it speaks to high workloads, having to cover multiple wards, managing large caseloads, being constantly contactable via bleep. It's easy to feel overwhelmed. There's a really poignant quote from an HPS in the sources.
What did it say?
I think we're constantly sacrificing a little bit of ourselves and our own needs because we're so intent on helping the next child that needs us.
Wow. That really hits home, doesn't it? The dedication, but also the potential cost.
It does. And the third subcategory they identified, being there, captures that emotional intensity of forming these unique, often very close relationships with patients and their families, and then being present with them during their most difficult, most vulnerable moments. It's a core part of the role, but as you can imagine, it carries immense emotional weight.
So facing that constant emotional weight, how do these professionals cope? What strategies do the sources find them using? Do they talk about that?
Yeah, they did. A big theme that emerges is this dichotomy of maintaining closeness and distance.
Okay, explain that.
Well, connecting with families and patients is rewarding, right? It's essential for providing good care. But the sources show that this very connection makes the experience of loss and grief much, much harder to process.
That makes perfect sense. You have to get close to care effectively, but getting close means it hurts more when when things don't go well.
Exactly. And the sources identify some less helpful strategies people sometimes fall back on. Things like compartmentalizing feelings, just blocking them out, disconnecting emotionally.
Sort of like a defense mechanism.
Almost, yeah. A form of self-preservation, as one source put it, just to keep functioning day to day. There's a quite stark quote describing this avoidance. I just kind of can't be bothered almost with their reaction to the horrible stuff that happens in work.
Oof. You can see how someone might get there, but it doesn't sound sustainable or healthy long term.
The sources suggest not. More helpful strategies involve actively trying to maintain that work-life balance, taking proper breaks, shifting to non-clinical tasks for a bit, maybe making resources, things like cleaning toys, just to change the focus.
Creating some distance.
Exactly. Setting boundaries is crucial. Learning not get too attached and take it all home with you, as one person put it. Prioritizing workload and learning to assert limitations also helps. And the sources note that this often develops with experience and confidence.
What about support from others? Was that mentioned?
Oh, consistently highlighted as crucial. Peer support is often preferred.
Why peers specifically?
Simply because colleagues uniquely understand the specific emotional landscape of pediatric care. Friends and family outside that world, however well-meaning, just often can't fully grasp it.
Right. They haven't lived it.
Exactly. The sources also mention the value of formal supervision and these multidisciplinary forums, like Schwartz rounds.
Ah, yes. Schwartz rounds. Those are structured group meetings, right? Where staff can share and reflect on the emotional and social challenges.
Precisely. A safe space to process the tough stuff together.
So, okay, pulling that together, what ultimately helps these professionals build resilience and, stay in such a demanding field?
Well, that peer and formal support are definitely key resilience factors according to the sources. Accepting limitations and practicing self-compassion are also strongly linked.
Self-compassion. That seems really important here.
Hugely. And gaining perspective from the work is another powerful element. There's a quote that really captures this. I've learned a lot. I think I've probably learned more from my families and kids I've worked with than I have from any textbook.
That's lovely.
Isn't it? Another person put it beautifully. I feel like I have such good perspective around what's important in life.
That perspective shift, seeing the strength and fragility of life through the eyes of the patients and families, that must be incredibly grounding, even amidst the difficulty.
It really seems to be a major source of resilience for many. Also, finding growth and fulfillment in the work itself, focusing on positive relationships, seeing children improve, feeling that sense of meaning and purpose.
The why behind it all.
Exactly. Oh, and it's interesting. One large survey of NHS staff mentioned in the sources found that working part-time was associated with higher reported resilience.
Again, pointing back to that importance of balancing the intensity, finding ways to manage the load.
Exactly right. The sources also suggest proactive steps. Things like ensuring training courses really address the emotional impact of the work and equip professionals with coping skills right from the start.
Not just the clinical skills, but the emotional ones too.
Precisely. And they point to things like mindfulness and acceptance-based approaches, MBSR, ACT, that kind of thing, showing promise because they help professionals, experience difficult emotions and thoughts without necessarily trying to avoid or suppress them, learning to sit with the discomfort.
Okay, so that gives us a really rich picture of the professional's experience. But while the staff find ways to navigate those emotional demands, the sources also offer such a powerful look at the experience of the young people themselves. Let's shift our focus now to the emotional world they inhabit. How does chronic illness impact them emotionally, according to this material?
Well, for children and adolescents, chronic illness is inherently stressful. And not just for them, but, as the sources point out, for the entire family system.
Yeah, you can imagine.
Kids can feel really different, isolated. Missing school, missing activities, missing time with friends. It can disrupt normal emotional development, especially during adolescence when identity and social connections are so critical.
And I suppose as they get older and understand their illness more deeply, their worry must increase too.
Yes, precisely. The sources show that as their cognitive understanding grows, so too can their anxiety about their health, about their future. It becomes more real.
The sources also frame this experience through the concept of vulnerability. But interestingly, not just as a negative thing.
Right, that was fascinating. They explore vulnerability as an essential part of being human. It's described almost as an existential phenomenon, part of the basic conditions of life itself.
So not weakness, but a fundamental state.
Exactly. And it's seen as contextual. It varies greatly depending on the specific situation, the culture. And crucially, it's relational. Our connections with others can actually make us feel more or less vulnerable.
Okay. But despite this inherent vulnerability, and let's face it, immense challenges, the sources highlight how these young people find ways to carry on. What does that actually look like in their lives?
A key insight from the sources is that it requires active interpretational work. They aren't passive victims of their illness. They are actively engaged in making sense of it, making sense of their situation.
Interpretational work,
Yeah.
like finding meaning.
Yeah, finding meaning, creating a narrative. A major part of this is striving towards normality, which the sources call identity work. It's about integrating the illness into their lives without letting it completely define them.
How do you do that?
Well, sometimes it involves comparing themselves to others, or maybe even to their younger, pre-illness selves, to frame their current situation in a more positive light, finding ways to see the continuity in themselves.
So it's not just passively living with the illness, but actively shaping their identity around it, or maybe despite it.
Exactly. They also focus on opportunities that might arise despite, or sometimes even because of, their illness. And maintaining a positive attitude towards their treatment, seeing it as part of that effort to carry on.
Right.
And drawing strength from resources around them, significant others, their environment, and their own inner reserves is vital. The sources mention how they might use narratives of normalization or frame their experiences as heroic stories or even quest stories.
Giving it structure, a narrative arc.
Exactly, giving it meaning and structure to help them navigate it.
And the sources provide specific examples from the young people themselves, don't they, that really bring this to life?
They do, yeah. You hear from Emily, she's an adolescent with diabetes. She talks about integrating her illness into her everyday life, looking up to her older brother who also had diabetes as a role model.
So seeing someone else manage it.
Right. And remarkably, she even saw her experience as a potential asset for a future career, thinking maybe she could help others because of what she'd been through.
Wow, turning a challenge into something positive for the future. It's incredible resilience right there.
It really is. Then there's Hans, a child with asthma. He had to deal with misunderstandings from teachers, teasing from peers, saying things like, says I am cowardly because I am puffed. Awful stuff.
Yeah, kids can be cruel.
But he found strength in areas where he could excel, like swimming. And he learned to fight back against the teasing, actively navigating those social challenges rather than just accepting them.
So leveraging personal strengths to overcome the difficult social and emotional parts, finding what you can do.
Exactly. The sources also briefly mention Ida, a young adult finding hope despite depression, and Astrid, an adult adapting to COPD. But the focus on Emily and Hans really puts a spotlight on those pediatric experiences of finding ways to carry on.
And for these young people, the research seemed to particularly emphasize the critical role of family support.
Oh, this is a really strong finding across the material. One study specifically looking at adolescents with type 1 diabetes found a significant association between family support and resilience.
That makes intuitive sense.
It does. And interestingly, the average resilience score in that particular group was lower than in some other countries studied, which, if anything, underscores just how vital that family safety net might be in buffering the impact of the illness.
So what does that family support actually look like day to day? Is it just, emotional encouragement?
It was often very practical and integrated into daily life, according to the examples. It includes family members learning the medical procedures, checking blood sugar, giving injections, providing regular reminders about treatment, about care.
And nuts and bolts.
Yeah, the real hands-on stuff. You hear young people saying things like, my mom practiced checking my blood sugar just like me, or mentioning a close friend who supports them reminds them not to get too tired and not to miss insulin injections. It's that consistent presence and practical help that makes a huge difference.
So it's not just emotional cheerleading, but tangible, practical support woven into the fabric of life.
Exactly right. The sources frame family support as a key protective factor in this thing called the resilience in illness model they discuss.
Okay, what else is in that model?
Well, other protective factors mentioned include social integration, so support from peers, from healthcare providers too, having positive expectations, spirituality comes into it for some, and what they call courageous coping.
And risk factors.
Things like distress, obviously, and defensive coping, like avoiding the issue rather than facing it.
Right.
And the sources also touch on the reality that parents' own struggles can impact their child's resilience. If a parent is really struggling, that can potentially lead the child to feel more fragile or anxious.
So the parents need support too.
Absolutely. It highlights the need for support for parents themselves. One source even mentioned the potential risk of PTSD for parents of children with chronic illness. It's a huge stressor for the whole family.
It's just fascinating, isn't it, seeing these different threads from the sources,
Yeah.
connecting the emotional experiences of the caregivers and those being cared for?
It truly is. What becomes really clear is the deep interconnectedness. The emotional demands on the staff are, inextricably linked to the inherent vulnerability of the patients they form these deep relationships with.
They're mirrors in a way.
In a way, yeah. Both groups are navigating incredibly complex emotional terrain, dealing with uncertainty, loss, difficult feelings, and both need to find ways to find strength to keep going.
And a common theme that just keeps coming up seems to be the crucial role of support, even if the specific forms differ quite a bit.
Absolutely. Relational support is vital for both. For staff, it's that peer understanding, maybe those formal support structures like Schwartz rounds that provide a sense of being held in the work, For the young patients, it's the practical and emotional scaffolding provided by family, by friends, by their social connections. The quality of these relationships, the ability to share openly, the understanding found within them, it seems absolutely fundamental for fostering resilience in everyone involved.
And both groups grapple with that challenge of allowing or avoiding difficult feelings and finding ways to make meaning from these profoundly challenging experiences.
That's a really good summary of it, yeah.
So, okay, pulling all this together then, what does this body of source material ultimately suggest about how we can better support everyone involved in this pediatric healthcare environment? What are the takeaways?
Well, the implications highlighted across the sources point to several key areas. For the staff, there's a strong case for embedding training that explicitly addresses the emotional impact of the work.
Right from the start.
Right from the start, and provides practical coping strategies, not just an afterthought. Increased organizational support is clearly needed, building on things like Schwartz rounds, perhaps, making them more accessible,
Yeah.
and approaches that help professionals engage constructively with their emotions, like mindfulness or acceptance-based therapies. They show real promise, according to the research. The sources even reference existing NICE guidance, suggesting managers should prioritize staff well-being. It needs to be a systemic focus.
Essentially, you can't expect people to provide compassionate care if they aren't supported, if they're running on empty themselves.
Precisely. You can't pour from an empty cup, as they say. And then for the young patients and their families, the sources really underline the importance of open, age-appropriate communication about the illness.
Honesty, but tailored.
Exactly. Maintaining normality and routine where possible is really beneficial. For teenagers, involving them in their treatment decisions respects their growing autonomy and understanding, which is crucial for buy-in.
Giving them agency.
Yes, and providing access to professional mental health support is critical both for children showing signs of distress and for parents who are struggling. Oh, and one source specifically mentioned that nursing care that focuses on identifying and building on the strengths of individuals and families.
Rather than just the problems.
Exactly. Rather than just focusing on the deficits or problems can be particularly effective. A strengths-based approach.
So we've taken quite a journey here, a real deep dive into the emotional world of pediatric healthcare. We've explored the remarkable resilience of both the professionals working on the front lines and the young patients navigating chronic illness.
We really have. We've seen the unique interwoven challenges they face, the different coping strategies they employ, some more helpful than others, and the absolutely vital role that supportive relationships play. Whether it's peer support for staff or family support for patients, connection seems key.
So after going through all that, what does this journey through the sources leave us with? What's the final thought?
Well, maybe it's this. Considering the complex web of emotional connections within pediatric care, how crucial is it for the entire system to recognize that building resilience isn't just about individuals bouncing back? Maybe it's more about strengthening the whole fabric of care itself, ensuring that those who provide the support are themselves deeply supported, ultimately for the benefit of the vulnerable children and families who are right at the very heart of it all.